This is the ITV Evening News with Alistair Stewart.
Good evening. More than 1 million NHS workers in England, from cleaners and porters to senior nurses, are being urged to accept a new pay deal. The government described the 6.5% increase over 3 years as a significant offer. Some midwives and physiotherapists will be among those getting the biggest increases. The package, agreed with most of the unions, now goes to a ballot of health workers. One union, the GMB, says it's jam tomorrow, and with inflation still high, it's just a sticking plaster. Here's our national editor, Allegra Stratton, on the government's NHS remedy.
It's been a long 7 years of flatlining pay while the pressure on NHS staff has just gone up and up. After bitter protest and the worst winter ever for the health service, finally today, a pay rise. In pay negotiations settled this morning, the Treasury found a substantial £4.2 billion of new money. The Health Secretary hailed the deal.
I think they are some of the hardest working people in this country. They've been working unbelievably hard over probably the most difficult winter anyone can remember. So this deal is a recognition of that hard work.
The deal affects 1.3 million workers in England, from nurses to midwives, ambulance drivers to porters and admin staff. They'll receive increases from 6.5% to 29% over 3 years. It will see the lowest starting salary, for example, someone like a cleaner, increase from nearly £15,500 now to more than £18,000 by 2021, a 17% increase. 13 of 14 unions back today's deal, but accept it could have been more generous.
Of course, it's not as much as we would like for everybody in the NHS. We always think our members deserve more. But what today represents is a significant step forward, a fully funded pay agreement from the government, who have failed to invest in our NHS.
But one union, GMB, will advise their members to reject it.
The devil is in the detail, and the details tell us that 52% of the total NHS workforce are only going to see a 6.5% increase in their pay over 3 years. Put that against where inflation will be over the same period.
This afternoon, Scottish and Welsh governments said they hope to strike similar pay deals. In England, there are many questions about NHS funding still to be resolved, how to pay for social care and the day-to-day running of the service. But today, with the arrival of spring, a thaw in the pay freeze for NHS staff too. Allegra Stratton, ITV News.
The new deal marks an end to a 7-year pay cap for some of the country's most vital workers. It's designed to support and retain staff at hospitals like Hillingdon in West London. Our social affairs editor Penny Marshall heard their reaction.
It's not been too bad for you, though, okay?
As news of the pay increase spread through England's hospitals, those caring for others were trying to work out just how good the good news really was for them. Here at Hillingdon Hospital, everyone had a different story. Ava Price is a healthcare assistant and has been with the NHS for 3 years. Her salary will go up by around 20% by 2021, which is around £3,200.
It will really help me very much, because trying to buy a house, if I didn't get this increase, I would be still on whatever I would be on. So I am well pleased for it, because personally it is going to be really helpful to me and my family.
Mary Sampson has been with the NHS for 2 years. Her pay will increase by around 15% in the next 3 years, a rise of around £2,300.
I work 37.5 hours a week, which I enjoy every bit of it, I must add first. And it can be from dealing with somebody collapsing on the floor, to serving a plate of food, to pushing a wheelchair. You always try to go above and beyond your job, always. So whether they give you £5 for a day's pay, you're still going to do the same job. But it is make a difference to get the extra. It will make a difference to me.
Sarah McDonough, a matron, has been in the NHS for 22 years. She'll get an increase of 13% over the next 3 years, which is around £5,300.
I think all hospitals nationally have had quite a busy winter. I think we're no exception, and I think we have worked extremely hard. I think I can put my hand on my heart and say I'm very proud of what my staff did. My staff went over and above.
For staff here, the reaction has been largely positive, although because of the pay freeze, this
pay rise has been a long time coming, and because it's been spread over several years, it's also being spread quite thinly.
Potentially, if all the I's are dotted and the T's are crossed, NHS staff could see their pay increases start